But today, Precious and I are going to be talking to you about preventive medicine, specifically screenings. So, we're going to actually introduce a new series. So we just kind of are coming off of our series of maternal health and reproductive health. And we had several really good and like fascinating episodes talking about all the things under that. So if you didn't catch it, make sure you visit True Health Live on YouTube. We have an episode with a fabulous doula, with a director from a hospital, talking about, what's needed with regards to advocacy. So there's so much, and it doesn't mean that we're finished. There's so much to cover in that topic, but that series is done for now, and we'll revisit that, at a later date. So now I want to talk about something that's really, really important, especially now that we're in like flu season and, there's all sorts of things going on. We are still kind of like in the midst of a pandemic, but I want to make sure that we're not forgetting about the things that are a little more common, because we're talking about what's trending and what's people are really scared about right now, which is the outbreak. But let's not forget about some of the other things that we have to be mindful of, and that's other diseases like cancer. And all the different types of cancers, heart disease, diabetes, high blood pressure, high cholesterol, all those things. And so with that, I want to talk about, or we are going to talk about the different kinds of preventive medicine that are available, specifically health screenings, so that we can kind of talk about those things. So I'm laughing at something that's happening off camera. The world is crazy. It's like interesting days. Um, so the first thing is what is preventive medicine? And also, what, Precious, this is really interesting. You'll notice like some of the promo for this podcast was preventative medicine, and then some things are preventive medicine. So I wanted to start there because it's a really interesting story. So they're both the same, preventive and preventative. And it really has to, you can find them both in the dictionary. And it really has to do with like, I don't want to say colloquialisms, but it probably is somewhere around that. And just like how English language evolves, and there's that extra that was put in there. But whether you use the word preventative with that extra t, or just preventive, they both mean the same thing, which is when we're talking about preventive medicine, which is a treatment to stop something, specifically like a illness or disease, from occurring. And you can do that through what we call health screenings, which are tests that are administered and used by clinicians to determine levels of health or presence of disease before there are any signs or symptoms. Right. So this is True Health Live, and it's about information. So we want to make sure that we have like those really basics down. The other thing about the preventive versus preventative, strictly preventive is the correct term, but I just want to be, fair to those of us who use preventative sometimes. So that's all I'm going to say about that.
I was like, why is she saying preventive? So thank you for that. Yeah.
Yeah, we gotta get it all out, because I was like, and I say that because just in case there are some language police out there, don't come for me unless I say it.
Right. You made that very clear, ma'am. You made that very clear. Like I was like, oh, let me have a seat. Let me have a seat.
I was because I looked it up. I was like, oh, but some things had already gone out, and I was just like, ooh, but because I always say preventative, and I was like reading, and I'm like, why are they saying preventive here? And I was like, but when we speak, we hear preventative. So it was interesting. I was like, well, let me like look into this, and so that's what I found. So there's some lexicon information in here too.
No, and I like the fact that we're going to delve into preventive, preventive, the idea of what preventive medicine is. And of course, as we go into that, we're also going to touch on some of the important things, lifestyle choices that you can make that also contribute to the idea of preventative I'm just gonna use them. Medicine. I can't. It's just in my head. So because really those screenings, right? Those, it's not just the screenings, yeah, preventive screenings, but also just preventive living, right? Let's not just think about what we need to get from the physician or from a lab, but
Yeah.
preventive living really can thwart or even turn back some of the bad things we do to our body, right? That cause
Mm-hmm.
imbalance and disease. So
Mm-hmm.
yeah. It's gonna be a fun month.
It is. I think so. So what we'll do is like, have different episodes that focus on a particular screening test or exam, and the diseases and the health issues that are either thwarted or found, in some cases based on those screening exams.
Mhm.
I want to share like how this kind of came about, but I won't go in too deep into it because we'll have a whole show about this. So it's interesting because as you age, there are certain tests that you have. So when you're younger, the tests are really simple, like, oh, you have to get your blood drawn, your height and weight, real simple things. But as you get older, there's colonoscopies that come about, mammograms, and things like that. So I'm moving up in age, and at that point where a mammogram is necessary. So we will be talking about mammograms. So what I'll do is I'll try my best to document that experience.
It's an
and,
experience. Since I'm
and we'll,
older and wiser, and it's an experience.
I'm so scared. I remember asking like, "Is it gonna hurt?" And it's just the assistant that was just like, "I don't know. I've never had one." I'm like, "Dang,
Like
Jen-
you're helpful. You're helpful.
dang Generation Z."
Yeah. It's
So
uncomfortable, but it won't hurt. You'll be all right.
all right. So we'll talk about those things.
Yeah. Yeah,
I'm
yeah,
not
yeah.
at the age where I have to do the other end, but we'll talk about some of those things. And we'll use this as since this, we're introducing what the series is going to be and talking about what preventive medicine or preventative medicine is, and like the need for health screenings, and like the benefit of health screenings. So we definitely open up this space to share, to have people come in. If you have a story that you'd like to share, definitely want to kind of open up the True Health Live space and invite you in as like a True Health Live family member, and have you share your story. Or if you don't want to share live, definitely open to having people send in. You can email truehealthlive@gmail.com, and we can read your story, and kind of discuss some of those things. And yeah, I think it's really good. And also when we share our experiences and what's happening, that's like some of the best evidence-based things that you can do. And yeah, they're going to be different, but it's really good to kind of hear what someone else has gone through. And this is kind of the premise behind the Masters of Health show on the other channel. When people can hear like your path and what you went through, because we do a lot of compare and contrast, right? But it's helpful because it's like, okay, well, this person went through this, maybe it may be easier for me, or maybe I can gauge like based on what I'm going through now what may happen. The other thing is though, you don't want to get stuck in like trying to predict. Sometimes it's better like just go. Don't try to predict anything, especially if you don't know. Just go so that you can find out the answers. So that's what's going to happen with this mammogram. We're just going to go.
But you know what? In sharing those lived experiences, though, yeah, no, we're not predicting that, this will be your experience. You know, but it's also sometimes affirming, right? That like, no, this did happen. This was what the experience was for me. Was it similar for you? And sometimes that's how we kind of identify pain points or opportunities for improvement. It's like, you know what,
Mm-hmm.
we're all having a very similar experience here. None of us talking about it until Deidre goes and, chronicles her experience and shares with the world who's watching our podcast right now and this live, the world. So as we share, then some of us will be able to say, yeah, That was my experience as well. Whether good or bad, I can't wait to share because I actually have a very funny, very vulnerable experience getting a mammogram. I was like, is this what you say to me now? Like,
So
maybe
yeah,
not now.
you see how that works. I remember, and so far, I think everything's. Oh my god, I think I just felt myself up on camera. And so, so far, I think everything's good because we know when we visit the doctor's office, different things happen, and you do get a physical examination. And so far from the physical examination, and again, as I talk about this, ladies, you should be also doing regular physical examinations on
Yeah.
yourself. That is a form of screening. Like, there are some screenings that self screenings that you can do at home. So we all know, you can, in the shower, sometimes they say in the shower it's good because the soap allows like
And
more.
gland, yeah, the
Right,
warmth from the hot
right.
water. Hmm.
Right. So, and then also like laying down. And also, it's not just the breast area, like the actual breast. You should be feeling all the way to up under the arm. So, these are some of the things. Say that again.
I'm sorry, yeah, because there are lymph nodes under
Lymph.
the arm. But also, it's really important, especially I don't want to say women of color, but I know women, at least in my family, sometimes they tend to have what's called cystic breasts, where
Mhm.
they just happen to amass cysts, and it can be attributed to maybe lifestyle, diet, etc. But you need to know your body as if like the way you know the route from your house to everywhere that you need to go. You don't need
Mhm.
navigation. You need to know your body so that
Yeah.
when you get a test and they say, there's a little mass here, there's a lump here, you'll know, oh no, that's been there. That's normal. Like it's always the size of, a little piece of sand and it's right here because you're doing those self exams or
Yeah.
screenings, right? Yeah, that's a good point.
Yeah. Yeah. The other type of screenings that we'll be going over, there's screenings, other screenings for other types of cancer, like colon cancer or rectal cancer. And some of those are colonoscopies. And so that's where, you have an endoscope. Endo meaning it goes internal inside of the body. Scope means it is something that the doctor or clinician is able to, or the tech is able to see inside of your body. So it's an endoscope that is inserted in through the anus and then rectum and then goes to, and is exploratory all through the colon. I've never had one, so I cannot explain what the experience is like. I can only verbalize what is supposed to happen. But this is, screening for different other types of cancers. And, when you reach a certain age, it is recommended that you do that. So we will be talking about that. So if you're someone who has had to experience a colonoscopy and, if you want to share, please, drop by and let us know. And we'll be talking about the importance of colonoscopies and those type of screenings. I do know one of my parents did have to, I think both of them. But I remember one experience and because they do put you into kind of like a twilight. It's not a full sleep
Right.
anesthesia, but it is like a twilight. So, it's recommended that you don't drive there alone, that you have someone who's able to come get you and pick you up so that they can take you home afterwards. So, some screenings are less invasive or more invasive than others, but as we age, these are things that we need to do. And that's
Yeah.
the reality of life and being in this physical body.
Yeah. I think as far as women, right, we always think of the mammogram, and even pap smear,
Mhm.
right, as a preventive screening. Um, Pap smears in particular are really important just for screening for cervical cancer.
Mhm.
But also, we spoke a lot about fibroids. And I would be remiss in not mentioning just how important it is to periodically, particularly if you're told that you have like really, really itty bitty, small, just one or two fibroids, which you may hear that in your 20s or early 30s, that you begin to make a note and request because it may not be offered at least an abdominal sonogram. There you can have there's abdominal sonograms that can help to measure and map out where your fibroid tumors are, as well as transvaginal sonograms, which it says what it is, right? Transvaginal. So a small scope is inserted, and they can also measure and better gauge, because you want to know those things. I'm going to stick with this whole roadmap idea, because once you know, then you walk in with a little less fear, because if you know last year, okay, there were this amount and they were at this size, and I made these lifestyle changes, or or I didn't, and where are they now? That helps you get a sense of what's happening in your body. Yeah.
Yeah, and it's good to know. Like, this is what you don't want to, because the other thing is, and we spoke about this on a previous show with Dr. Khadisha about how many times melanated people don't like to go to the doctor, and you'd be surprised, and a lot of them are in the clinical world or in the health world, and it's like it's a thing where it's like, I don't want to go to the doctor, and a lot of the times, and I've experienced this, with personally with family members, because they're afraid of what they might hear, and the fear is real, it is real, but once you get it done, it's better to know, because then it's like, okay, what are the next steps that I can take after this, now that I know? Because when you don't know, this is how people who are melanated also have higher mortality and morbidity rates from diseases, because they waited. And so by the time they go find out, they're in like final stages, or stages where nothing can be done, or things are irreversible. So, the screenings are really, really important to do, so that you can at least know. It's similar to now, it's like, go get a test, people are getting COVID tests. But if you don't know, I mean, you'll know if you have it, but sometimes it's good to, just find out. Find out if you've ever had it, because maybe you have been asymptomatic. We do know that that exists, but it's good to know, so that you can make, like you said, Precious, like the changes, what changes do you have to make, or haven't you made, in order to address that. I just want to like take a beat and just welcome the chat. Greetings, top tier speakers, and Sister Kashia. Thank you for joining us. Kashia did confirm I did have a little feel up session. Apologies. So we are talking about something like really, really important when it comes to health, and the status of our health, and like understanding and knowing the health. Kashia says she's one of them, which is I think she's talking about one of the people who doesn't go to find out what's wrong, which is why I strive to be healthy and go when I must. Required yearly or year and a half check-in. Yeah, so I do try to do those. And here's the thing: if you're doing what you're supposed to do, then all you really need is your year or half a year check-in, and they just get shorter and shorter. If you're doing what you need to do in between, everything
Right.
should be good. There shouldn't be any issues. Yeah, we may have outliers, because there's just, the reality is, there's so many things in the food, in the air, and there may be things that you could have been exposed to that might create something. But for the most part, if you're doing what you need to do, you should be pretty good. That's not necessarily the case, for everybody, because our bodies are different and we all react differently to different things. Yeah, there's going to be similarities and some generalizations we can make, but this is the key to making sure that you're living right, eating right, you're healthy, you're doing your exercise, and then you're also screening, because that's what they are. It's before there are any signs or symptoms. So, yeah.
And then just the idea of, even with the annual physical, if you will, understand what your physician is checking for when they do blood draw, because every blood draw is not created equal.
Right.
I remember being recommended to this really, really awesome, he kind of mixed allopathic and some of the more naturopath approach to medicine. And he took so many vials of blood and walked me through. No, but it was amazing, because he actually walked me through. I know, I was like,
I'm always like, that's
oh,
supposed to
die
be
right
inside.
here.
It's
Right,
supposed to
that's
be
supposed
inside.
to be in me. But his, the phlebotomist, or the nurse who did the blood draw, she explained everything they test for, that the traditional, like a traditional physician would otherwise not test for, things like heavy metals and it was actually really, really informative, and it helped me appreciate how my diet was impacting some of those results, some of the results that labs that were really good. He attributed to the like lifestyle choices and some of the other areas where it was like, oh, well, your protein. I was like, oh, well, I'm vegan. So there was that, right? So know what your physician is testing for, even in blood work,
Yeah.
because you may say, well, I went every year and they said everything was fine, but all they're actually checking for is like your cholesterol level and just the basics. So
Yeah.
we always speak about and advocate for being a self advocate and knowing and
Mhm.
asking those questions. So be informed. And if you know things that are not common are common in your family, make sure you mention that and that you ask to be tested for that. Another thing that comes to mind really quickly is if you're of the generation that got fillings that were full of mercury, you may want to make sure you have a heavy metals test done. And if at all possible, begin to work with your dentist to have those removed and to have amalgam, I think they're called amalgam fillings, the white ones,
The white
have those,
one.
yeah, to
Mhm.
replace them, because that'll have a huge impact on memory. Um, I can't even go into all of the things that
So interesting.
mercury.
Yeah.
Yeah.
My parents have the silver. If you have silver colored, like in your fillings, you will want to go and check that out, because there's so many people that I have like come across where where they have to go to the dentist because the tooth cracked and the filling like leaked in, and I'm like, oh my gosh, like what does that mean? So yeah, those are things that you want to go and check out, because it gets into the system, and then you have to think, well, what is that doing, right?
Yeah.
So yeah, that's interesting. I'm like,
Yeah. And just to connect it, I did that many, many years ago. And I actually, my OBGYN, soon after kind of applauded me for doing that, because she actually, and I have not fact checked this, so please do, but she actually said that removing those mercury fillings actually, or keeping them in, could have an impact on fertility, which I didn't realize. So as you know, I've already shared that I kind of gestated with fibroids, but there is a relationship or connection between the two. So it's just another thing to put on your list and to look into for yourself. Yeah,
mm-hmm.
yeah,
Yeah, no, I think you're right. Like on the about they have a higher women who have the mercury. They have a higher, because what happens is the metal is tested in the urine, and so they
mhm.
have a higher level of incidences of infertility.
Oh, okay.
Mhm.
Yeah, yeah, yeah. So, see, it's all, so you got to map it out. Map yourself. Just draw a little picture of yourself on a piece of paper and just start checking in checking in, especially as women. We tend to, prioritize everything and everyone else. So let's make this important,
Yeah. Mm-hmm.
screening.
Yeah, yeah. And so like other kinds of screenings. So like screenings for diabetes, that would be done like through the blood. So when you're talking about blood tests, when your doctor or physician or clinician orders what they call an HbA1c, that and they'll say fasting HbA1c, that is the test that tests for type 2 diabetes, because type 1 is usually you have it when you're young. I think you're
Yeah.
born with it.
Hmm.
And we know that type 2 is the one that melanated people suffer from the most. Um, and so what you'll do is you'll fast. I think the fast has to be between 10 and 12 hours before the blood is drawn. And you can find out if you will be are pre-diabetic or diabetic. And there's a range. And here's the other thing: when they talk about blood work, it's not just about like, okay, get the blood work and the doctor says blah 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 blah, you're good. And if you're good with that, that's fine. But it's really good to know the ranges, the way that they determine if something is good, because there is an average range. I can't remember the ranges off the top of my head, but there's an average range that your your platelet count should be, so all the things that they test in blood taste, there's a range that they go from. And if you're below, that it means one thing. And if you're above that, it means something else. Sometimes if you're above it, it means like, well, you may not be there, but you're creeping. So this is what we need you to do to get back into the normal range. And what you want to do is make sure that things are within the normal range. And yes, melanated people are different. We're different. Yet and there does need to be, maybe some revamping of what standards and norms are, so that they include the differences of different ethnicities and different bodies. At the same time, these standards mean something. So if you're in this space where you're above, then take it as, especially when it comes to diabetes, because this is the one that's killer. As our guests, our regular Sister Kashia mentioned on a different show, um, until like toes and legs start missing. We like our toes and legs and arms and fingers. We like them. We don't want them to go missing. So if you're above that range, take heed, be mindful. It shouldn't be like, well, this test isn't meant for, no, it means something and it's useful. At least this is what we have now, and it's useful. So take heed of that. We don't want like toes, legs, arms, and fingers to go missing. I've seen too many of that where it's unnecessary. So, make sure when you're getting your blood work, be aware of like what your ranges are. If you're below, if you're too high, and actually get the blood work. Don't be, it is nerve wracking. So I don't want to say don't be afraid. Be afraid, but push through it. You can be afraid, but push through it and get it done. Because again, once you know, then you can actually take the steps to reverse or correct or adjust what needs to be adjusted. Yeah. That's what I'm going to say about these.
I know we're talking about all of the physical health screens, right? But I wouldn't be me if I don't bring up just the mental health and the
Of course, I wanted you to talk about those screenings. Yeah.
See, I knew it. But I'm not gonna, we'll get into all of the different tests and assessments and screenings and, and self-assessments, because there are a myriad of links and websites for mental health screenings. But what I will say is, particularly for parents, there's something called first break episodes. So a first break episode is just that, the first instance of something happening with our youngster, our youth, right? Our children. So being able to understand what that age range is, right? So oftentimes you'll find that in most children who are going to experience some sort of challenge with mental health, if it doesn't happen by the age of 18 to 21, it isn't going to happen, right? Maybe something will happen as an older adult, which is really more a situational response. But often the first break happens during that 16 to 20 year age range. And that's because if you think about it, what's happening then? You're entering into adulthood, you're preparing to go to college, or you're on campus and having to manage life, right? You think you're managing life home, or you're wishing you could run your own life. But once that truly has to happen, there's so much pressure that there's onset of depression or even psychosis, more chronic psychosis. So it's really important. But then, of course, there are some children that experience first break episodes at 6 and 7. So there's usually that 4, 5, 6, 7 age range, or that 16 through 21 age range. It's really, really essential that elders, not just parents, but even educators and and healthcare practitioners, they're trained to recognize those signs and to not ignore them. It's not, I know, our children act up and they respond in certain ways and you go, oh, that's just Johnny being Johnny. But sometimes early intervention, right, is that preventive medicine that's needed. So you have to be able to recognize those warning signs. So we'll get into some of what that looks like down in
Yeah.
the month as well. Yeah.
And you know what? Some of these, they're so extensive. That this is why they need their own show. And that's why this show is not like, we are not going to be talking about all the screenings in one show. Like, they actually need their own show. Just because there's so much involved. So we'll get into like what they look like, what's supposed to happen, all of that. So right now we're just introducing the concept and like getting you guys ready. And so maybe in between now and the next show, we'll have inspired you to go get a screening, even if it's just like to get like a blood workup, to find out if everything's okay metabolically, for right now, so that's great. So willingly, even in between now and the next show, I'll have documented my experience.
Dun, dun,
You're
dun.
not right. Dun, dun, dun. I'm not gonna. I don't think I'll show like the actual like what's happening in the room, but I'll give you guys a play by play, or maybe I don't know, maybe a recording. We'll see. We'll see what that looks like, because it's like, okay. So yeah, screenings, they're important. Really quickly, because she says she asks a lot of questions when she goes. What's that for? Let me see these labels. Do I ask for specific blood work? So I do know. I think since she's here to do the workup, and it's just like you should know. And like in that moment, it's like, be the annoying patient, because you should know. It shouldn't just be like one person like lording over to tell you like what's what. You should know, which is why in between these physicals, these annuals or half year physicals and check-ins and checkups, you should be doing the right thing, because you're knowing, you're paying attention, you're alert as to what's happening with you, what you're taking in, and how it's affecting you externally. So you should be that patient. Ask those questions. I don't know if I always ask enough questions when I get the check-in, because you might be so relieved to have good news. You're like, okay, yep, okay, bye. See you next time. And I wish I didn't have to see you,
Yeah.
But it's good. It's good to ask those questions.
I think like you said, do the right thing. Doing the right thing is asking the questions. Doing the right thing is taking notes or recording the dialogue, because sometimes there's so much information being thrown at you, particularly when there isn't necessarily fantastic news being given, that
Right.
you're still hearing the echo of the not so great news, that you're not hearing a lot of what's coming thereafter. So if you don't have someone with you, right, because maybe you aren't expecting to hear anything unpleasant, ask if you can record what's being said. Ask if, or not. Depending on what state you live in, you don't always have to ask. Some states are one-way consent states. So that's something you should know as well. Hint, hint. I'll just say, I know for sure New York is a one-way consent state. You can record without the other person consenting. But these are important things for you to do, because maybe you need to play back when you get home. What did he say? And what was that test again? And how can I research that? But to answer the other part of what I thought Sister Kashia might have been asking, don't wait until you're in the room with the phlebotomist to ask what tests are being taken. Ask that when you're sitting with the physician. Usually you sit with the physician prior to blood work. Sometimes it's after. But try to make sure you have that conversation, even if you say, you know what, I prefer to do my blood draw after. I just want to talk a few things over with the doctor. Or I think, or it could be as simple as, I had a few questions for the physician first, that may shift the blood work that needs to be done. So it might be better to do it at the end. And then that's when you reel off, I really think that while I may not fit, the time frame for this and this and this test, or they're not common, but I would really like to have them anyway, just to get a baseline. 9 out of 10 times, as long as your insurance covers them, they'll give it to you. You just have to ask. And the only other thing that I thought about connected to the physician is, do your research when you're picking your physician. That is key number one. Oftentimes we're resistant to going for testing, or because, like you said, we don't want to hear the bad news, especially our elders. But a lot of it is also that trauma response, right? We know how we're going to get handled. But you can manage that. You can prevent that by being really vigilant and diligent about vetting your practitioners,
Mm-hmm.
and really finding practitioners that align with your philosophical perspective on life. Because they're out there, they're doctors that understand what's happening and what the an informed patient wants, and isn't just kind of trying to get you in and out in 3 minutes flat. So, we've got to just do the legwork.
Right. Yeah. I had like an experience where the doc, this is like years ago in college, and it was just like, I was like, something's wrong. Let me go check this out. And so she's like, okay, I'm going to send you for a scan. But it was what she said before that. And I honestly don't remember it now, but I know it was like an ultrasound scan, because I just felt, I was like, something is wrong. And this is my reproductive health we're talking about. And I'm like, I'm very young and something is wrong. And so let's talk to the MD about this. And so, um, I forgot what she said. I really did. But in the moment, what I remember is the emotion. That's what stays here. But what was said is totally not in my brain right now. But I heard her say scan. And everything she said after that was Charlie Brown's mom. Wah, 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 wah. Because by the time I got to the scan, I didn't realize that I wasn't supposed to eat. When you have scans, like, they prefer empty stomach because they want to make sure that they're picking up only what they're looking for. I wasn't supposed to eat. I wasn't supposed to drink. And then I was probably supposed to have contrast. So then by the time I got to the scan, I think they had to do a different kind of scan because I had not heeded anything that she told me, because I was not cognizant of what she was saying, because I was, and it wasn't even bad news. It was just something I didn't want to hear, or I was just afraid.
Nervous.
And I was nervous and I didn't do anything. Turns out everything was fine. And, everything was totally fine. But in my head, I was like, I'm dying.
Right.
I don't know why I thought that.
Right.
But it was like, in my head, it was just like, I'm dying. I don't know. And everything was fine. It was
Yeah.
totally fine. It was fine. And it was just like that the whole time in between that appointment, like speaking with the clinician and then actually going to the scan, I was a wreck. Didn't know anything. And it's not a good space to be in. So you do want to like make sure you do your research like before and after. And yeah, and I was very young. I was like living on my own. I was in grad school. So it's just like,
not today, right?
I have an exam. What's happening? I literally had like a meltdown. And this is in Boston. So in Boston, the mass transit system is called the T. And we were on the Green Line. And we're outside of the main campus. So this is Commonwealth Avenue, very well-known area. This is where the main strip and where Boston University, like their main buildings, sit. And I literally had a meltdown. I was like, I have cancer. And then, like, my friends are like looking at me like, this chick is crazy.
Oh no. But it's scary.
A whole meltdown on the Green Line in the middle of the street.
I'm not gonna laugh. I might be tearing, but a laugh isn't gonna come, okay?
No, it's fine. It's fine, because I was
but you know what? It is scary. And as you shared that story, it made me think of yet another tool that we have, and that is to ask for it in writing. When your physician is giving you instructions, particularly as it pertains to a screening or test and how you prep, it is very easy for them to have their assistant jot it down for you. No water after, midnight. No this, no that. You have to come like this, come like that. They know, and they know we are going to forget, particularly if our brain is kind of preoccupied with, I need to have a test. Oh, dear goodness, I'm going to die tomorrow. So yet another thing you can do, just can you put that, can you write that down? What do I have to do? And this applies to our elders as well. I'll share a really quick story. My grandmother at the time, she was like 94. And, by then then it's like all hands on deck. All the family is together. And they're primarily in another state. But I'm the healthcare girl, right? I'm the healthcare granddaughter. So as she was going for different treatment modalities, it was like Precious has to be, if she can't be in the room, she's got to be on the phone. And that's what they did. They advocated for meetings, virtual meetings. This was many years ago, virtual meetings where we could all hear, we could all ask questions, we could all take notes. And that was very affirming for my grandmother, but it also gave the physicians and the team, right, the social worker and the healthcare team, an understanding of what what we were going to deal with. I'm just going to say it, and what we were not going to deal with, because it wasn't just her and one person, or her and and a home care assistant, and you can just move her through the system. Sometimes we have to take that time and be a show of force. Sometimes that's what it takes. And so don't be afraid to say, you know what, I can't be there, but I'm going to be on the phone to hear what's going on. The system is set up to support that. And so we have to be encouraged to use those tools and to advocate for ourselves. So just another little something to think about.
Yeah. And I wish I had all my wits about me.
No, you were young. Listen, we needed that for us to get to this right now and tell people right now. Don't do that. Don't do
that.
Line.
It was like tears all day. Sitting on, and I think I wrote about several train lines that day, crying like on the phone. Like, she said this, and she's like, my mom. She's like, I don't know what you're saying. Like, please, please stop. It just continued throughout the entire day until I was able to get it out of my system. But it was just like nervous wreck until that day. And then I found out, like, when they told me that, yeah, you were supposed to do such and such, I was just like, and I wanted to say that the doctor didn't tell me. And then I was like, she probably did. Because
you were busy crying. You were busy weeping.
I started in the room. I started in the exam room. The tears were just, and I remember, like I said, I don't remember what she was saying, because I remember this person sitting in front of me, and I was just like looking, and I was just watching her lips, and the tears just started welling up. Sound goes away. Everything goes away. So like, it's not a great feeling. And like I said, that it's like ingrained in my memory, like what that felt like. So, you may have an episode like that. So you want to make sure, like, beforehand, can I record, or can you give this to me in writing? Because you're going to need time to process and kind of come out, especially if it's not good news.
Right. And just one other thing that popped in my mind, when you reference lab work and the range, right, and being within normal range or out of range, whether plus or minus out of range, yes, it's important to recognize that some of us are just abnormal, and abnormal isn't necessarily a bad thing. It just means that you don't fit into bell curve theory, right? And that's okay. I am abnormally short. So that is, I don't fit in bell curve, right? But that said, I need to know what that means, right? And that's what's important, that you know what that means. So just because your labs come back as, abnormally high or abnormally low, recognize what that means for you, how that impacts you, your body specifically, and what the preventive measures are that you need to put in place to remain balanced, because you may just hover at that, 1 or 2 over what is considered normal, but that may just be where you hover, right? And with no symptoms other than, okay, this is my baseline. It's really, really important that you know your baseline.
Yeah, that's a good
point. Yeah,
good point. So I just want to reiterate, Is there another? Yeah, we talked about blood work. Da, da, da. So, and there are more. So, the shows that are coming, we're going to do a show on mammograms. We'll do a show on colonoscopies. We're going to do a show on like the different mental health screenings and so on and so forth. So it's going to be great. It's going to be awesome. I'm so excited about it. And like I said, you are welcome to share your stories. We'll work you into the show and we can, have you on and you can tell your story or you can write us email. I'm not looking for like postal.
Pen
I mean,
pal.
that's fine too. That's fine, but I'm not giving my address, so it'll have to be email. So you can send an email to truehealthlive@gmail.com, or you can go on to deidresully.com and write a comment. We're definitely happy to have you share your story with us. That would be great. It'd be awesome and an honor to have people share like their real life lived experiences, because what you say will definitely help someone else. It's all about information and things being based in evidence. And yeah, you may hover, as Precious said, at someplace else, but it's good because somebody listening may be at that same point. So, and even the stories that we shared today are helpful. So you can kind of get a sense, but like you're not alone. We all have like those moments. So preventive medicine screenings, they're really, really useful. They're a useful tool in gauging where we sit, with our health and the condition of our bodies. So that's what we wanted to definitely share today. Make sure you tune in next week where we talk about some of these health screenings. We'll be talking about, we'll do the cancer first. We'll do the colon cancer because I don't know if I'll get to the mammogram. I'm really busy. Or maybe I'm just putting it off. No, you guys are going to keep me accountable. We're going to go. So we're going to start with the colon and then we'll do the mammogram and that'll be an experience. So join us next time right here on YouTube and also whatever podcast platform you are listening to. We are on iTunes. We are on Spotify. You name it, we're there. So make sure that you tune in next time. Same place, 11 a.m. on Sundays. And we will be talking about some of those screenings. If you want to talk about a different topic, we're kind of moving because we're getting close to the end of the year. And so we're thinking about what season 2 looks like. So as always, if there's something you want to talk about or something that you want to, give for the show, you can email us there. So in the meantime, we will see everyone in the forward. Thank you so much for joining us today. This is our casting call for our preventative medicine screening shows coming up. So give thanks, everyone. Thank you so much for joining us, and we'll see you soon. Peace.
Peace.